insurance companies may require a 3-month or even a 6-month medically supervised diet prior to surgery. So that's something that we just have to look into, see what your requirements are. It's important to know those because they have to be satisfied. If they aren't, then the insurance company won't approve the operation, so they won't pay for it. If your insurance company has the benefit and they cover the operations, if you meet the criteria, then they can't say no. So if your BMI is correct, if you had a history of it, those things are all lined up. If the only thing that is variable is the diet, whether it's 3-month or 6-month, then it's just important for us to do the diet and have you do that with a medical doctor just so that we can get the approval for the operation. Another common question is pregnancy after the operations. It's actually healthier to have a pregnancy at a normal weight versus being severely obese. However, during that rapid weight loss phase, which for most of the operations is in the first year, it's a little more difficult for the baby doctors to monitor the baby if someone's pregnant and losing a bunch of weight. Baby doctors are kind of used to patients gaining a little bit of weight as they're pregnant, not losing the weight. So in order for just a easier pregnancy and to be able to monitor things better, it's recommended that you don't get pregnant in the first year. It's important to understand in saying that after surgery, you have to be aware of, when we talked earlier about the potential problems of obesity and causing infertility, a woman of childbearing age can go from being very infertile to very fertile very quickly. It can sometimes happen in the first month. That menstrual cycle can kick right back into gear with 20, 30 pounds of weight loss. So it's important to just be aware of that and just take precaution in that first year to try to avoid pregnancy. Because you can become pregnant right away, and even in the first month after surgery. So it's recommended to avoid that. Alcohol is another common question. Alcohol in the form of beer, because it's carbonated. Remember, carbonation, we recommended that you don't. Alcohol, there's not a strict contraindication to it after having the operations. There's a relative recommendation to not drink in the first year after surgery because you're losing a lot of weight. That puts kind of some stress on your other organs, your liver and that, and alcohol also affects that. A little bit of wine or that type of a thing with dinner is going to be okay, but you just want to be careful about the amount and the quantity. A lot of what you drink will get digested into your bloodstream, so it doesn't take as much alcohol to get a little bit tipsy. And also there have been some reports of some people who may be prone to alcoholism of potentially taking food as an addiction and kind of going into something else. So that's something that you want to be careful with as well. There's no evidence to suggest that having a bypass or a band or a sleeve will cause alcoholism. It's just a matter of the behavior that was already there that may lead to that if you're not careful. So alcohol you want to watch, but beer you should avoid because of the carbonation. And that's about it. So if you have any questions that I haven't covered, again, there'll be a spot for you to write us, and then we can get back to you with the answer. Okay? Thank you for joining me, and good luck with your journey.